Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today, my guest is Tom Moorcroft, and Dr. Tom treats some of the sickest, most sensitive patients suffering from chronic Lyme disease, also tick-borne co-infections, mold illness, as well as children with infection-induced autoimmune encephalitis, which is also known as PANS or PANDAS. He focuses on optimizing the body's self-healing systems in order to achieve optimal health with simple, natural interventions, utilizing more conventional approaches when needed. He's the creator of Thrive with Lyme Blueprint, which assists those suffering with Lyme and related illnesses, and they can tap into the true source of radiant health within them and optimize their own healing. He also teaches practitioners how to easily and effortlessly excel at treating patients with complex chronic illnesses in his Lyme disease practitioner certification and mentorship program. Dr. Tom's goal is to empower each of his patients to get in touch with their inner source of health so they can experience optimum health, which is what I love about Dr. Tom. So welcome, Dr. Tom.
Thanks, Allie. Thanks for having me. I'm really excited to be here.
Oh my gosh, I anticipate a lot of Lyme disease parents out there are going to be hitting the follow button really soon after listening to you, because although you specializes in all things Lyme, I'm particularly interested in talking about our children, because in the Lyme disease community, as you know, they're our biggest community of Lyme disease and also tick-borne illness. And oftentimes, and we'll talk about it and we'll get all into it, but it's often so easily misdiagnosed, and treatments oftentimes don't work. So let's just start out, and can you just give me a little of your background and how you became interested in Lyme disease?
Yeah, thanks for the intro. It's always so interesting to hear all the things that you do, and it's nice to get a little reflection. Like, oh yeah, we're actually helping the people who are in need right now. Actually, I kind of grew up loving Mother Nature, loving being outside. I went to college to study wildlife biology and terrestrial or land ecology. I was just so enamored with the natural world, and so I just did the things I love, which is what I always try to get people to do, is like, don't do what I want to do or what you want to do, but like, what is it that really opens your heart and really, because when you're doing the things you love and you're passionate about, healing and being motivated to take some supplements or medicines if you need to, it gets a lot easier because you're kind of got that energy. And so I was just following my heart and my dreams of learning about the world. And I started to learn a lot about the outdoor world, like from a scientific perspective, on top of just, personal enjoyment of it. And then I realized that I was in a bunch of meeting rooms with a bunch of other people who looked exactly like me, in our jeans and our ripped up shoes and boots and our flannel shirts. And we were talking about the same thing over and over and over again. And I said, the problem here is that we're not getting anything done. We're pontificating and we're researching, but we're not putting it into action because it takes so long when you're an adult. So I was like, who can I talk to who, if I share my love of Mother Nature and get them stoked about it, will actually go and take action? I was like, oh, kids. So when I got out of college, I said, rather than research Mother Nature, I'm going to teach other people how to really love Mother Nature and share the research, but really implement it, which is a lot of what I do now with Lyme. And so the long and the short of it was, I took an AmeriCorps internship at the Institute of Ecosystem Studies in Millbrook, New York. And lo and behold, while I was teaching kids about, the stream and the creek and the pond and sugaring and why they would want to preserve and enjoy Mother Nature, I got Lyme and babesiosis. So basically, my boss found me one day staring at a computer screen. There was drool all over my stomach and my pants. And she's like, what the heck is wrong with you? And so I go to the doctor, and the guy's like, oh, and then between the time that we realized I was, needed to go see a doctor because I was obviously cognitively severely impaired, I started to notice more of my muscle pain, my joint pain, and fatigue were there. But then I developed a rash that covered about a fifth of my body. So it didn't look like your normal erythema migrans bullseye rash. It was like this really weird thing. But I go into my dad's doctor, and the guy goes, within 2 minutes, he's like, Tommy, you've got classic Lyme disease. Here's your doxycycline for 10 days. Take it. You'll be good to go.
Mm.
And so I was 23 for the first 3-4 days. I laid on the floor. And it was July. I was alternating sweats and chills. My parents literally had to carry me to the bathroom, which is pretty much when you're 23, pretty much sucks to have your mom take you to the bathroom.
Yes.
But anyway,
Yeah.
so I started to, and I started to feel better. But then after that 10 days was up, in retrospect, over the next several years, I started to get sicker and sicker, and the joint pain, muscle pain came back, the fatigue and all this brain fog. And so I started to go see the doctors, and they're like, well, you're just depressed like your old man is. I'm like, no, my body hurts and I can't think. So I'm mad that you're not taking me seriously. And so then after the depression medicines didn't work, they go, oh, you're probably bipolar, like all, the type 2, just like all the good lawyers and doctors. So I took all those meds and they didn't work. And then somebody came up with the brilliant idea that I had ADHD. I'm like, well, anybody who knows me is like, duh, no kidding. And that's like my superpower. It's not a problem. I mean,
Yes.
I was okay with that one. But then it was like, I went to my doctor and I was like, dude, I've got joint pain and muscle pain and fatigue and brain fog for the last like 6 years. What is wrong with me? And he's like, oh, I know, you have fibromyalgia. I'm like, dude, all you just did is tell me that I have the exact same thing, the label of all the symptoms I just told you. And that doesn't help me know how to get better or give me any hope that I can get better. And so at that point, a little coincidence occurred in my life after I fired that doctor. A friend of mine gave me a yoga DVD. And I was at this point so decrepit and felt so much pain that I could literally, if I put my arms down when I was standing up, I couldn't touch my kneecaps, which is
Mm,
like not really that far to reach when you have really long arms.
for
So, but
sure.
I started doing this yoga, and this is kind of like what really changed everything for me was the people who taught me said yoga is not about contortionism and all the cool stuff you see in the magazines. It's about movement on breath. And so if I were able to breathe fully, I was doing it correctly. But if I was pushing too hard, that and my breath got tight, or I couldn't fully expand my lung, I was going too hard. And so I was like, wow, that is really good. I'm supposed to do an hour and a half a day, 6 days a week, except on the new and the full moon. I can do about 90 seconds. And
Hmm.
so but they said was, when you can't do any more, keep breathing for the rest of the hour and a half. So for about 6 months, I did mostly nothing but breathing. And then it got further and further. My body started to heal. I started to learn to listen about what foods were good and not good, not through a textbook, not through a video, but literally through personal experience. And about 2 years into this amount of sort of like military ish yoga practice, I was about 75% better. And I still needed to meet a couple of doctors who changed my life and helped me with that last 25%. But that was really the journey. Is I wanted to teach kids about loving Mother Nature, and Mother Nature shared a gift with me that at the time didn't seem like it. And so then, I was just, when I went into practice, I was like happy to live my life. But then I saw one person with Lyme and I treated them because I knew what it felt like. And then I treated another person, and then it became literally 100% of what we do. So that's kind of how the long way of how we got here.
Well, that's incredible. And it's also incredible that you were such a curious 23-year-old and somebody who was relentless in your pursuit of finding the correct diagnosis. I was a lot the same way. I just could not accept the fibromyalgia
Oh my God, right?
and pain disorder diagnosis that I had received, because I was thinking to myself, I'm too young for this. And I was just doing like spinning class, 4 times a week. And none of this makes sense. So I love the fact that you trusted your intuition so much that it got you some answers. So,
If I can add one little piece here that I don't want
yeah,
to forget, I'm sure it'll
yes.
come back up. But one of the gifts that I was also given by not knowing was basically I didn't know what I had. And so in retrospect, I'm like, oh my God, everybody wants the label. I was so lucky. I had no label. I had no hope. I didn't know about natural medicine. I mean, I was in osteopathic medical school and I knew that we did some cranial sacral work and this energy work really drew me. But I literally, that was the most I knew at the time. I knew chiropractors cracked your neck, doctors cut stuff out or gave you medicine. And these osteopaths that I trained with did a little extra. And I didn't know anything about what I knew today. And so I was I didn't I wasn't in a box. I wasn't in a Lyme box or a Babesia box because what turns out was when 8 years after my initial tick bite, I actually was diagnosed with Babesia that the first guy missed. So I could
Mhm.
have died from Babesia being not treated, but thankfully that didn't happen. But it's just interesting to not know what it was. But I decided, I remember really clearly, I was standing in the apartment one day and I'm looking at the wall, kind of like how my boss found me staring at a computer screen. But I was looking at the wall and I go, I know that path. I'm going down that path. I've been doing it for 6 years. And if I know what the result of this path will be. So is there any other path? And I was like, oh, that one that got me so interested in the outdoor education and teaching kids and the one that got me the Lyme disease, I still want that. I want to play outside. I want the
Mhm.
dogs. I want the family. You know, I was recently married and I didn't want that to just go to, and it's like I just had this whole life in front of me. I was like, I'm just going to go for that one because I already know what I'm getting over here. And I never
Sure.
forget that I'm in pain and I can't think, even though I couldn't think. I certainly wasn't forgetting I couldn't think well. So anyway, I just found it so interesting. I was never a limey, a moldy, a babesia person because I didn't even know what the label was. And I refused to be a chronic fatigue fibro person because that was just stupid. So I just felt so like lucky and I'm so grateful that I never had the label until the time where I was ready to accept my body was ready to accept the treatment because it went so much faster with these two wonderful docs from Maine who saved me that last 25% of the way, but I had to do at least 3/4 of the work. And I just find it so inspiring that you don't have to follow the label and you can still get better. And then when you put the label on it, if you've done the work first, then you can supercharge it and get it done much more quickly.
Great. Great take on it. I love it. So let's get into pediatric Lyme.
Mm.
There's so much to cover, obviously, but why don't you tell me about your experiences with pediatric Lyme? I mean, we can talk about, how that actually presents itself in the classroom, for example, or treatments or emotional imbalances. I mean, when you're looking at a child with Lyme disease, talk about, what you're seeing.
Yeah. Quick shout out to my buddy Charles Ray Jones, who passed away about a year ago. But man, what a guy who just pushed it. And the reason I bring him up is I lived right down the road from him, about 40 minutes. And when there was no money for training available, he just said, hey, if you make the time in your schedule, you can come and learn from me. And just so I did. And I spent like years just going down multiple times a week and maybe taking a couple weeks off and then going back. But I mean, Ray just was
Mm.
made such a huge difference in so many children's lives. And I'm just so grateful to him for opening his door for nothing. And as long as I was willing to dedicate my time, he was willing to do the same. And I learned so much. And then I could kind of, we're all here on the shoulders of giants. So a lot of what I know about the pediatric presentation, I just, is from Dr. Jones and then my experience with his tutelage. Um, but yeah, I mean, the thing is, like, when we're in medical school, everybody always says, hey, kids are not just small adults, so a lot of times we're dosing medicines differently and all this. And we see this in Lyme. I mean, very uncommonly do I see a kid present with joint pain, fatigue, and brain fog, right? It's more like, one of the classic things that we find is kids who have belly pain and they've gone through the multi-million-dollar workup and then they just said, oh, your kid's crazy or something. But isolated abdominal pain is actually one of the most common presentations of Lyme disease in children. And so it often gets missed because people are like, oh my God, why is my kid's stomach killing him so much? So we do go see the gastroenterologist. And that's a really big, I mean, I'm not saying don't do that, but just when like if you look back at my story, that all the medicines that they gave me for the things they thought I had didn't work normally. So a lot
Mhm.
of times what we see with kids is like, hey, they have a behavioral disruption, a change in their behavior, and your doctor puts them on, say, Zoloft or Prozac or Paxil, right? And all of a sudden, the kid's super agitated and rageful, and you're like, well, that's not what I expected from that medicine. And we don't typically see like 6-year-olds with manic depression, which that presentation could occur in an adult. But so when we look at that, we just say, hey, that's not normal. So then we go, why am I responding abnormally to a typical medication? And if I rewind a little, a lot of times what we'll see with kids is acute behavioral change. So they get bit by a tick and they're in the classroom, and then all of a sudden they're like stabbing another kid with a pencil, whereas before they were best friends, or they
Mhm.
have acute ADHD or acute anxiety when they've never had it before and they haven't had like a major, a life-changing event like the death of a friend or a grandparent or something that would trigger it. So a lot of these abnormalities, so we certainly see things like, the dizziness and the lack of balance. But in adult, like the kids I see don't usually say they're dizzy, right? The parents are going to notice they're bumping into things. And here's my sporty kid who no longer has any stamina. They used to have a ton of balance and now they're bumping into everything. So those are the kind of things we look for. And
Mhm.
then when you have a lot of times in children, like we're also going to see sort of when you're doing the intro about that infection induced autoimmune encephalitis. And that's really a Dr. Jonesism where we break out what PANS and PANDAS really mean. So PANS is really talking about this pediatric acute onset neuropsychiatric syndrome. And that's just an acknowledgement that they're a kid and they have an acute behavioral change. And, the thing we see though is if we step further back, it's an infection triggered autoimmune process, which also leads to dysregulated inflammation. And that's where really Ray broke it apart into those three basic pieces that help us as a framework. So we do see your happy-go-lucky kid, all of a sudden they're seeing regression in their school performance. They're seeing regression in their handwriting or their art or their drawing. They're a great piano or guitar player. Now they look like they've never played before. We see behavioral regression, acute ADHD, acute rage, those kind of things. And so anything that looks like odd and then can fall into that category. And then also tic disorders. So a lot of like if your kid has acute Tourette's, right? That's not a thing. So they're doing the grunting, the shoulder squinting, the eye blinking is really common, or the breathing through the nose, flapping with the fingers. But these are previously neurotypical or kids who are pretty much, regular normal kids. They have their own little nuances of who they are, but now that's changed abruptly. That's really commonly seen. And now that's more that autoimmune encephalitis piece of the picture that's triggered by these infections. But it's really interesting. I very rarely see a kid who just got tired and their joints hurt. Now we can
Mhm.
see that, but it's typically more that extreme presentation. And I think that also the reason I'm always like, why am I presenting the non-classic presentation of pediatric Lyme? It's because I see the people that got missed. So there are definitely kids who get a rash and they get a swollen joint and they get brain fog and fatigue. And somebody goes, oh, you got bit by a tick 3 weeks ago while you're hiking. Oh, there you go. So I don't see those people. So that still is a presentation too. The
Sure.
other thing I always like to mention when we're talking about school and school age children is some of the infections that we debate whether or not they come from a tick, including Bartonella. Um, in Europe, we see like 70% of the ticks in some studies have Bartonella and only like 30% have Lyme. So in different areas of the world, it's different. But in the United States, we do see some studies where ticks contain Bartonella. We see other studies where they do not. So, but like with all science, the bigger the study, the more the information we get. So we're definitely seeing some Bartonella in certain regions and not in others. But the other part is we have to remember like lice also carry Bartonella. Spiders and fleas and a few other things do too. But I always, when we mention the classroom, when we see lights go through a classroom, very frequently, a few weeks later, you'll see a bunch of kids with acute anxiety, a bunch of kids with regression, a bunch of kids with new onset OCD or rage, new onset ADHD, and maybe it won't be everybody gets one. One kid will develop OCD and picking, another kid will develop a tic disorder, and then all of a sudden you have three other kids with brand new ADHD. So if you're a teacher or a parent who is talking to other parents, think about this because it could be non-tick-borne Bartonella. and we don't want to just, and I try to not lump them together, because then the doctors and the infectious disease docs think we're nuts. But if we're like, we have lice go through the classroom, we have a vector for things that look like Lyme that also trigger PANS and PANDAS.
Oh my gosh. All of a sudden, I'm feeling so sorry for those teachers. I mean,
Right?
because it just seems as though these occurrences used to be very rare. You
Yeah.
know, when you and I went to school, there might have been one or two sort of, obvious things. Now I feel as though every family has one or two kids with different presentations of everything you've just mentioned. So I want to go back to the symptoms as well, because I talk to a lot of people that say their children get inflamed knees, swelling in the knees. And I always wondered, and of course that's how Lyme disease, even I think, in Lyme, Connecticut, that was the story of the one family. They all got these swollen knees. Is that something that you see as well as a symptom in children?
Yeah, we definitely see in adults and children that get swollen knees. But what's interesting is we're kind of, I think, as a medical society, we're all taught one big swollen knee, but a lot of times you'll see kids with two micro, like a little bit of swollen knee, but for no reason. So we definitely see swollen knees. And going back, like when if you take like a swollen knee and then you add on migratory pain, this is some of the most important. Migratory pain or migratory numbness and tingling is really almost nothing else. And with an adult, you could have an STD that causes that, gonococcal arthritis, but most of our 7-year-olds are not going to be at risk for that, right? And so the list gets really short, and some of the hepatitis can cause those migratory pains, and inflammatory bowel disease. So like if your family has like Crohn's or ulcerative colitis and your kid has a swollen knees and pain that migrates around their body, the options for what could be causing it, the potential underlying cause, could be a little broader, but it's only like 5 things. So if you have swollen knees, definitely be thinking about it. And then we have the other one that everybody's favorite is growing pains. And this is a challenging one, because I've seen kids with pain in their legs from Lyme and Babesia who also have growing pains. And it's really hard to figure it out, but we have to put other symptoms together with it. So if you only have pain in your legs and you don't have that swollen knee and you don't have the migratory pain and you don't have some of the other things that we've talked about, and certainly it makes it a little more like growing pains, but it shouldn't be incapacitating. And I'm always amazed that we just call it growing pains. Why don't we just evaluate the kid a little bit further? Because when you look at Lyme, I mean, it's like fatigue and executive function problems / brain fog. So in our kids, it's the memory and the learning, but it's also memory and learning tie in a lot to anxiety and fears. I've had kids who will lock themselves in one bedroom and that's the only place they'll go. I mean, that's not normal. And unless there was like a home invasion, there shouldn't be that symptom. And then we go, and it's like every system we can get heart. It's interesting too, because a lot of our kids don't complain about heart palpitations, although some do. Or racing heart rate. So you can have a real racing heart rate, like you have tachycardia, very elevated, or you can have a borderline or just the sense of a racing heart rate. And that's often, a lot of people are talking about the vagus nerve and all the other good things that go on. But the vagus nerve goes to the heart and slows the heart rate down if it's working properly. But if it's negatively impacted by a Lyme, which there's studies that show that, then we wouldn't see that. Then if you go down below the diaphragm, that muscle of breathing into the belly, that 75% of your intestines are getting, the vagus nerve is the one giving all the energy, the nervous impulse for it to function. So a lot of GI things. So you'll see kids who will all of a sudden develop diarrhea, or all of a sudden develop constipation, or everybody's favorite irritable bowel syndrome, where that's back and forth. Then we also see a lot of kids, and this is a little bit more common in kids and adults, as they start to have problems with a lot of different foods. And then they go to the naturopath or the osteopath or any functional medicine person or a healthcare practitioner, and they end up finding they're allergic to 75 foods. Well, you can't be allergic to 75 foods unless your gut is inflamed and you have leaky gut, because it's just not a thing. You're not allergic to being alive. And so the more food allergies that people have, or the more foods that bother them, the more likely they are to have a Lyme or a co-infection in the gut wall, or they've got mast cell activation syndrome because of the presence of chronic infection, which then messes up the gut wall. So the gut is a big one. And again, just to always reiterate, like isolated abdominal pain is like present in like so many kids with chronic Lyme disease. And it's just something to be aware of.
Thank you for all of that. I really appreciate it. Um, let's talk about treatment for children, because obviously we don't want to go into heavy drugs with our children. They can't make it through the school day.
Right.
It's got to be really tricky to treat them. So what are your favorite types of treatment that are often safe, or the best bankable bet you can make with a child with Lyme disease?
Yeah, I mean, it's an amazing question. And I think I was going to say earlier, one of the things I've gotten so good at treating adults is because I've treated children. And while children are not just small adults, adults are kind of like grown children. So I've learned a lot about how to address adults better by having to learn how to be more effective at treating kids. Because one, all the things you just said, and also they just don't tolerate taking 17 different things in a day. They're just like, yeah, I don't think so. Um, so any of my chronic people, especially my kids, I tend to start, if they've been sick for 4, 6, or 8 months, and it's always individual. I tend to start with herbal treatments for a couple of reasons. One is I have almost infinite control over the dose. So if we do give them a little bit too much and they flare up, we can ratchet it down pretty easily. The
Mhm.
other one is we have some really good combinations that are in glycerin and some that are in alcohol that are, some are very tolerable and some are not so much. A lot of our glycerin based combination products are, you can put in the food. So with a lot of our more sort of strict adult versions of what we do, we're like, oh, don't put it in with food. I'm like, well, I don't know. Like if we use things like Beyond Balance, Susan McCamish is like, put it in food if you need to, mix it with whatever. And, so that's really helpful. The other thing is I use a lot of tinctures in our younger kids who can't swallow pills. And then we put it in, I use a lot of modified citrus pectin as a base because we can get it in a lime flavor. And so it disrupts biofilms, it heals the gut, it's anti-inflammatory. And oh, by the way, when we mix it with our herbs, the herbs don't taste like crap. They don't always taste great. So we have a lot of ways to mask things. But I've seen as simple as using Hellman therapy, where you have someone who won't tolerate anything. I can get them to taste that kind of like diluted pickle juice, like once every 2 weeks. And then
Mhm.
we get their immune system and their gut more modulated. And then they can tolerate it a little better. So the more sort of like obstinate your child becomes, that's you, unless they were that way forever and you help make them that way, which most of our parents are not trying to train their kids that way. It's the infection driving it. But when we go back to Ray Jones's approach, which I love, is like we're looking at those three main categories that trigger PANS. If we can hit that middle and we balance the autoimmunity, that will also bring down inflammation. So we've now got 2 of the 3 categories handled. So you don't always have to bang on the infection to get, to be making progress and protecting the body. And then usually my kids, like if I can only do one thing, I do that. And then once they start to get a little bit better, then they're open to the others. So I find that things like the herbal preparations and like all the research we've had at Johns Hopkins has really revolutionized what we know works on a person. So, and if I can only get one thing in, it might be cryptolepis. Is it the be all end all for everybody? No, but it's also the thing that's been shown to totally eradicate Lyme so it can't regrow. It's the only thing we've ever studied, which is pretty impressive. So if I can get one thing in, great. And then we can build on that. But kids, sometimes I'm like, hey, a little bit of chocolate syrup with a little bit of that terrible word sugar in there. We have to balance the priority,
Right.
right?
I mean,
And
I'm
so,
picturing them trying to take a tincture down, I mean, that's
right.
crazy. I can
But I
barely
will
do it.
say that the combinations from Beyond Balance are great. I love the Byron Whites and the Nutrimetics. I use a lot of Lime Core, which is, but everything besides the Beyond Balance is really about, it's an alcohol based tincture. And so Beyond Balance, most, not all, some of it tastes terrible, but most of it with the glycerin base is a starting point that really helps our kids quite a bit because they're cool with you taking with food. And it's also just a little bit on the more palatable side. To some of them, kids love. And
Mhm.
then one of the other things kind of interesting too, if the practitioners or the parents out there are bumping into a wall trying to get other things started, a lot of the kids who look like kind of that PANS type of presentation, sometimes our antifungals really are massively immune modulating. Even in a kid where I can't find mold, I can't find candida, which is rare, but especially with the mold exposure being someone who sees mostly people from the East Coast, but man, even the kids with nothing that I can find, those antifungals really balance the immune system and act like a modulator. And then so I'm like, hey, they're good on that. Now I can add something else, 3 or 4 weeks later because they're feeling better. I mean, a lot of
Mhm.
them are like, nobody wants to take cryptolepis. Go buy a bottle of it and try it. You'll know exactly what I mean. Nobody wants it. But a lot of our kids want to get better. And it's a matter of what I found with kids is less is more, and just if they can do one thing, let them do that and be successful. Don't try to get them on the 5 drug protocol. The other thing is homeopathy can be very helpful for helping the body to remember that the Lyme or the Bartonella or whatever it is not them. So a lot of times I'll say, hey, as we go through a protocol, let's do this. It's only once every 3 days. And you can mix it in something like orange juice. Again, I'm not promoting taking lots of orange juice is essentially IV glucose and IV sugar, but we find that balance point. And then the other, I guess the flip side of the coin is I wouldn't be afraid of antibiotics. And every once in a while, a little azithromycin or amoxicillin tastes a hell of a lot better than an herb.
Mhm.
And again, I put it all into this picture of I'm an osteopath and I think of your body as having a self healing mechanism. And my goal is to catalyze healing and then remove whatever leftover catalyst is there once it's no longer necessary. So if you need amoxicillin for 6 weeks, great. If you need it for 6 months or 5 years, great. But I don't want to keep you on it longer than I need to. So I think of the herbs and the homeopathy that way and the medicines. So whenever we're starting it, it's just a trial of treatment. We see what happens. But with the kids, it's like build on the small successes because if really in the end of it, Ali, it's like what's going to happen is the only thing that we really know for sure in chronic Lyme is other than it's a real thing is that duration of therapy is probably the number one thing. So you can try to get as fancy as you want, or you could just do one thing for a longer period of time. And that's
Interesting.
why, Dr. Jones is so successful at treating kids. It's like, I don't agree with putting kids on 4 antibiotics for 5 years without any change and hoping it'll happen, but it does. So then we can learn from that. But if you're on a treatment for 9 months and you can only take one bubblegum flavored antibiotic and you can sneak a probiotic into your food, that's probably better than fighting and torturing your child. So you just have to find the balance point there.
Yeah, yeah. I'm sure most parents, when they hear Lyme disease diagnosis, especially if they don't have it, haven't had experience with it themselves, hit the panic button and start doing all sorts of things at the same time, which can also just really annihilate the situation and make it much worse. So, do you recommend any body work or so let's just say a kid came in and they were experiencing acute Lyme disease symptoms. You would start them on the naturopathics, herbals, um, and but would you ever recommend, some of the typical things we do as adults, like sauna or IV or anything of that nature?
Yeah. Well, I think for acute, I tend to pound people with antibiotics so it goes away and herbs because the antibiotics aren't good for persisters, but I might do two things and mix them together. But for chronic stuff, I definitely think that, and again, like I'm defining chronic pretty loosely. It's like 4 months or more of symptoms, so that's pretty, by the time anybody gets in my practice, unless you're somebody's already a patient and just got bit, that's already happened, that's them.
Yeah.
So most of the people probably listening. And so, yeah, I mean, I think sauna is great for kids. Again, like they're developing and less is usually more. And literally sometimes 90 seconds to 3 minutes of a sauna is enough to kick on detox. I typically don't ask you to do like a coffee enema in a 6-year-old, although I'm sure someone's done it successfully. I don't, but yeah, things like the sauna, the castor oil pack is good. Even just a warm shower
Mm.
or a cold shower followed by a warm shower, a little cold exposure. Because one of the things I always try to do is stimulate this thing called autophagy, which is essentially a fancy word for how your cells recycle, clean themselves out. It's like spring cleaning for the cells. And that helps us with longevity. But exercise promotes autophagy. A little bit of cold promotes autophagy. And so intermittent fasting, a lot of people follow, and that also promotes it. So anything where you're using up some energy so that your energy goes down a little bit. So like my daughter's 13. She doesn't tend to eat a lot in the morning. I don't tend to eat a lot in the morning, and I fast a lot because I've always naturally been that way. Did she learn that from me, or did she learn that from just being naturally that way? I don't know, but I didn't. She's growing and developing well. So if your kid's like not hungry, don't make them eat before school. Now, if they go to school hungry and they start complaining on it, yeah, obviously that wasn't the right move. But simple little things can actually clean up the body. Um, Intravenous stuff I typically don't do a lot of, just because most of my kids don't like getting needles. And I want to promote maybe taking a little sugar out of the diet and putting in a few more nutrients if we can. But I think that when we look at the things that we really want to do, we want to improve lymphatic drainage, right? So lymphatics are sort of that main system in the body that's going to clean up all the toxins so that you can get rid of them in your pee or your poop. The thing is, in your arms and your legs, we require muscle contractions. In your belly and your chest, it's pressure gradient changes. And in your brain, number one detox supplement is sleep. Somewhere, depending, the research is a little still new on this, but it's 70 to 90% of your brain detoxification happens during sleep.
Mm.
So the things that I do with kids is get them to move, because that's going to be better than any glutathione I give them, IV rectally, in a nebulizer. Now, it doesn't mean I don't use oral glutathione. It's just that if I want to mobilize as much as I can naturally, and kids are more likely to go play, even if it's just jumping up and down on the bed. So every once in a while, it's like, hey, well, the kid wants to jump up in the bed. I don't want them to, but I'm going to hang out with them so they don't fall off. But I'm going to let them or they get a mini trampoline. It's one
Mm-hmm.
of the best lymphatic drainage techniques in the whole world. And then when they're jumping and they start to have a little bit of joy, which is nice when you don't feel well, then you're also getting your heart rate up and you're breathing a little deeper. So now, and then when you burn off a little energy, you sleep better. So mini trampolines are really good. Just running around and playing if their health can. I do a lot of red light therapy because there are some very inexpensive versions. There's some very expensive versions, but like Therasage has a great light, it's a couple $100 rather than a couple thousand. And a lot of what we see is that some of our treatments that we use with our older kids who can take capsules and our adults, like methylene blue for Lyme and Bartonella, are photoactivated. So one thing would be to go out in the sun, which is always really good. But if they're sick or it's the wrong time of year, red light therapy can help. So I think a lot of the adjunctive stuff can help. And I mean, I love hyperbaric therapy. Anybody who's looked in the, recovering from autism, they use tons of that. We use it in our house. I use it in my practice. I have patients get hyperbaric chambers. You can use them at home. Again, it's like an hour, something, I forget if it's 20 minutes or 40 minutes, but it's like in a hyperbaric chamber is equivalent to like just shy of 3,000 milligrams of ibuprofen without any gastrointestinal side effects. And it can actually help promote good bacteria.
Incredible. What about things like coil? I mean, what's your experience with that?
I don't have a lot of experience with the amp coil itself, but I think energetics work. I'm
Or
always trying to figure
PEMF,
out.
maybe the PEMF pads or anything like that. I'm trying to think of
Yeah,
things
absolutely.
that a
Yeah,
kid could do while
PEMF
they're
is
laying there watching TV.
absolutely right. And it's funny because I'm just sitting here, and I've even got like my red light thing here that I had on before we hopped on. And a lot of times I'll have people put that on right while they're watching TV. The PEMF devices are amazing. We definitely use them. I have multiple different devices myself. One of the things, we have that upcoming Lyme Summit. We have people talking specifically about that topic because it's really about some of the things have really good marketing behind them, and they have really low power. And then other ones are the ones that we really want with higher intensity. And so a lot of the PEMFs are looking at different frequencies and this and that. And it's really about the intensity of the field you're exposed to. But those are actually exceptional. So I definitely think that those are things that you can look at. The other thing I was thinking about too, when you talk about frequency, is the other thing without the P in front of it, which is the EMF.
Mm-hmm.
One of the things I try to remind people to do is to grab, if they have a Wi-Fi router, which so many people kind of have to now. It's really hard to hardwire your house because most of your computers won't even connect to the internet through a wire. You can find a way to do it, but it's usually complicated. Turn off your Wi-Fi router at night. And so the easiest way to remember to do that is to put it on a timer. This way you can't binge watch like crap on your computer until wee hours of the night, nor can your kids. But the Wi-Fi signal is very irritating to the nervous system, and it's very pro-inflammatory. And if you do a live red blood cell smear on someone who's exposed to high levels of EMF, it'll look exactly like your blood cells would look if you had lupus or rheumatoid arthritis,
Wow.
aka another autoimmune condition. So it's a lot of inflammation. So if we turn off our Wi-Fi at night, say, 10 o'clock to 6 o'clock, our brains get a break, our nervous system gets to calm down, the immune system and the blood cells get to chill, and everybody gets to sleep a little bit more. And so I tell people to put it on a like a $5 or $10 timer. Just set it once and forget about it. I mean, you might, if you buy the fancy timer, you don't have to remember about daylight savings, but or once a year you have to switch it around. The other thing is this bad boy. I use mine as my alarm clock. It's about 6 feet from my bed, preferably be 12, but I don't, but I turn off. I go in there and I turn it on do not disturb. That way, only like my phone's on if my kid's out somebody else's house and I need an emergency call. But the other part is turn off the Wi-Fi and the Bluetooth on the phone, because even if you turn
Mm.
off the Bluetooth headset and you turn off the Wi-Fi router, your phone will continue to try to connect as long as it's on. So this is like, so just super simple stuff where you just turn these off at night. And my daughter woke up the other, it's really, it wasn't funny. I was gonna say it's funny, but it's good timing for our conversation. But she woke up and her neck was killing her. Like literally our whole day as two osteopathic physicians was spent fixing her neck. It was so
Wow.
painful. But she had moved the phone cord and she had put it next to her head. And I'm like, wait, when did this happen? Doesn't go down in my house. But it was like like the side of her neck that was killing her. Like the phone cord was running right now and the phone was right there. And we were
Uh-huh.
like, she also was in that kind of age where she started to like mess around, cracking her neck and everything. I'm like, no, we can help you with that. And also turn the phone off. And it was amazing just getting the phone and putting it back where we all agreed it was healthy enough,
Mm-hmm.
then we were good,
Yeah, you have to really investigate with those teenagers, that's for sure.
right?
And then it always turns out being something just like that, like it's the phone cord. Okay. While we're talking about treatments with kids, can you talk a little bit about the cranial sacral?
Oh, that's like one of my favorite that's what I thought I was going to do for my whole career, is get paid to meditate, right? And so the cranial sacral system is really cool. They defined it as the gentleman, William Garner Sutherland, was an osteopath, and Dr. Still, who was the guy who created the osteopathic profession to introduce common sense, and which is like stop using arsenic, strychnine, and like bloodletting. And by the way, introduce manipulation because it works. They all thought he was crazy, so he had to make his own thing. But him and Sutherland had done a lot of work looking at the way the body functions. And so Still charged Sutherland with looking at the cranium, because everybody thought it was fixed. The cranium has compliance, and whether or not your sutures in your brain and your cranium close or not, it still moves in a rhythmic way. And we have a lot of evidence now that of the different ways that the nervous system moves. So the cranial sacral system was one of the early ways they described it. And they said, hey, the head moves one way, the sacrum or your tailbone moves another. And it was one of the first times where they started to talk about how the nervous system is connecting the whole body. And when people do cranial sacral work, when we're trying to write in our medical documents, we're trying to be all like anal retentive and make sure the medical board likes what we wrote. So it's very kind of like more reductionistic. But the cranial sacral system is a way to interact with the body as a whole. And we can work on pieces, but the way it works best is when you remember it's part of the whole. So we're literally, my self-healing and self-observing mechanism is interacting with your self-healing mechanism, acting as a catalyst.
Mm.
And one of the things that's really important, though, is especially with brain detoxification, especially with the vagus nerve. And a lot of people these days are talking about the limbic system when we talk about recovering from chronic Lyme and such, and all the limbic retraining. I'm like, I can directly change it. I have science that shows I can put my hands on your head and your neck and your tailbone, and I can actually change the tone in your vagus nerve and your limbic system. I don't need drugs. I don't need fancy programs. I can literally do it with my hands. And I can teach people positions to put their body in where they can do a self-treatment. The other part, though, is like if you look at PANS and PANDAS, we talk a lot about the basal ganglia. And these are areas in the brain that are essentially part of that limbic system, but they get a little more credit when we talk about PANS, or especially PANDAS, which is just the same phenomena, but from strep, where we originally started talking about this, because the basal ganglia can get a little bit bigger. So the brain doesn't change size, but the basal ganglia can in the acute parts of this encephalitis. And what we see there is that cranial work can work on all of these levels. And the goal is not to fix anything. Like, this is, my daughter was a little bummed out because she wanted me to fix her neck pain instantaneously. And I'm like, I'll try the technique that does that. But the reality is, I'm going to give you probably 2 or 3 treatments today because it's so acute. You're going to feel better tomorrow, not today. And
Mm.
sometimes the kids are like, and they're actually usually a little better than the adults. The adults want it like, here's I paid you with my credit card. I want the product in my hand.
Right.
So, but the cranial sacral system is a great way to sort of look at the person as a whole and
Mm.
and calm down the nerve. And usually when we address it, we're balancing out the nervous system. And we get very parasympathetic typically. And so the vagus resets, the gut resets. The gut resetting allows the immune system to reset. And it's really a global treatment. So it's very profound. And most kids love it because they just have to lay on a table and talk to somebody or go to sleep.
Is it more energy work or is it an actual manipulation?
That's a great question. I think the board answer is it's a manipulation, but it's kind of like energy work and fluid work and vibration work all put together. And
Mm.
it's heart work, which is again vibration or energy. So it depends on how you define it. We do certain there. My feeling is, because I've learned a lot of techniques. I taught cranial work for over 10 years. I was on the faculty of all these different teaching organizations. We use technique. This is my opinion. We use techniques as an access point to learning and therapy. So for a new practitioner, they're learning a technique so that they can start to make a difference. But to someone who now is at level 2 or whatever, just the next level in their understanding, our teacher said, I spent 15 years figuring this out. I'm going to teach it to you in 20 minutes. And now you can, like Ray Jones, let me stand on his shoulders. Now we can stand on their shoulders. And ultimately, the technique is irrelevant, but it's an
Mhm.
access point. So yes, when you go to some practitioners, you'll see them do more moving. Now, as an example, if my kids, after her neck, like with her neck, I was doing techniques on areas. But once I did that technique, I also stepped back and I said, oh, what is it? Why is this thing out of whack in respect to the whole? Because a lot of times our techniques or our manipulation is we crack their neck and 5 minutes later it's out of place. We crack their back and half hour later it's out of. I was like, well, why? Well, that's a compensation for something else. And the
Mm.
beauty of the cranial sacral approach is that it gives you access to say, this one little spot is off. I'm going to help you there, but I'm also going to look at the entire body at the same and beyond at the same time, so I know why it's off.
I see.
And so, as an example, for a lot of your listeners, we're talking about kids, right? I have a family that I've seen all 3 of their children, and one kid came in with what we would consider a compression of the bottom of the cranium, the skull, and it's a functional thing. It's when nobody broke their head, they didn't hit him with a baseball bat, although that is a way to get a compression. But it was like the kid came in and their head wasn't really moving all that well. So of course their brain didn't feel well. So I treated them and it went away. It resolved, and they started feeling better. Their headache went away or whatever else. And then, I don't know, like 3 months later, their sibling came in and I had the same finding. And it was really like, that's a little weird because it's like almost exactly the same. And then mom brought all three of them in one day. And I was like, well, what's going on? Because all three of them had this compression of the cranial base. And what was really interesting was her and dad just had a massive fight and basically were screaming divorce, and he left. So the
Mm.
beauty of this story and this cranial sacral system is it's not just a physical thing. So you can have a emotional, mental, biochemical change in your brain and your heart that we can then use two things. We can diagnose some of it physically. All three of them had a similar compression and some of them that wasn't their normal pattern. So it was abnormal. And now I'm like, why do three people in the same house have the same pattern when they're usually different? But
Right.
then also, a lot of times, and this goes back to treatment of Lyme in general, sometimes I can't get the kid to take the herb or the medicine they need. Sometimes I can't get the IV in their arm that I want. Well, wow. Or we don't want to put them on an SSRI like a Zoloft or a Prozac. I treat them, I release the strain on their cranial base, it opens up. But the reason it was caused was, in this particular case, was an emotional event. But they can heal from the emotional event that I don't even have to have them talk about. I don't have to have them relive the trauma. I can physically allow the energetics of it to release through the physical system. The body is so freaking smart, Allie. This is the part I love about
It's
not,
so great.
you know,
I'm fascinated by it. My dad was a kinesiologist actually,
oh,
and
rad.
above and beyond that, I just even though I'm healed from Lyme disease, I just went and did an incredible session of fascia work where, he went deep and we were talking the whole time and just releasing and continuing to release. I mean, it's work that is never done. You can always do more throughout your lifetime. Okay, a couple of things really quickly before we wrap
Yeah.
up. Um, are you running into any occurrences of alpha gal with children or adults for that matter? I'm noticing in the Midwest it's really on the rise, and they're saying they're now mentioning it in schools. It's almost now being referred to similarly as the peanut allergy, where you have to send your child in and everybody in the class knows that this is a thing, and the
Right.
lunchroom and all of that. So are you seeing any
Yeah. I,
any more cases than maybe you have? Maybe it's regional, I'm not sure.
I think a lot of it's regional. I mean, I think it's kind of, we're thinking it's Lone Star tick driven. So people with Lyme, Babesia, Bartonella are typically, we're not talking about a Lone Star tick bite, because that's from an exoides tick like the deer tick or or which is called the black-legged tick, or the Western black-legged tick if you're on the other, on the California side of the country. I see a little bit of it. I've
Mhm.
seen a handful of kids with it, like three maybe in the last 14 years. And I've seen a handful of adults. Now, granted, I do have a lot of patients from like the Carolinas and Florida where we see it, but that's not the most common. It is sort of a little bit more west of that where I hear more of it.
Yeah.
The people that I've worked with, the one adult that where the first person I ever saw with it, he just gave up red meat and was just like, whatever. And we treated him for his other symptoms, and he just isn't even willing to try it. He's like, I don't even care.
Right.
The couple of kids I've seen with it, they've gotten better and able to handle red meat after treatment.
Mhm.
Again, it's like a lot of what we've talked about, extended treatment. So I don't
Okay.
see a ton of it, but I certainly, the ones I have seen, especially in kids, they've gotten better once
And
we
it
treat
seems
them.
like that would be an easier one to diagnose because it's so
Well, and the
obvious,
Lone
I
Star
guess.
tick is also huge compared to a deer tick. I mean, the 95% of Lyme is transmitted by a nymph deer tick, which is the size of a poppy seed. And a
Mhm.
Lone Star tick is, compared to that, I mean, it's like the size of the tip of my pinky finger. So it's a
Yeah.
I mean, so it's harder to miss, but you definitely can get it. So definitely be on the lookout.
And then with regard to children having Lyme or tick-borne illness and adults, is there any truth to children recovering more quickly? Are they able to sort of recover slash heal? Does it come back later in life? That kind of thing.
Yeah, I love the conversation of like new cars and used cars. It's like definitely I find that like kids tend to bounce back a lot better. Some of the challenges with getting there are they're more restricted in what we can use with them or what they'll be open to. Um, but yeah, a lot of the kids, and I mean, I'm not saying that there's not a 6 or 8 year journey here, right? I mean, sometimes it's
Right.
6 or 8 months, but there's a lot of parents listening are going to be like, well, it's been a long time. I Most of my kids do get better and stay better. And if you watch like Under Our Skin and all the follow-ups and stuff, like some of these kids that Ray Jones had on antibiotics for like 7, 8 years are now like fine. you know um I definitely see that, especially if you get the pans and pandas kind of overlap where your infections are triggering this additional autoimmune thing. um we do need to address the autoimmunity and the inflammation in addition to just treating the tick-borne illness. But as their immune system matures, which may be 18, 25, 28 years old, because it's not that their immune system was going to mature later, but it seems like if you get hit when you're 8 or 10 or 12 years old, that can prolong the maturity of the immune system. And by that, I mean, the problem with PANS is that your immune system hyper reacts to things or underreacts to them. So I want to get back to normal. But when your immune system's all off, it might take a little bit longer than just, oh, your 18th birthday, you get the papal blessing and you're fine. It doesn't really work that way. But the other thing, though, is kids do tend to, because they're in that growing phase, they can have really big flares and stuff. But once they start to get on that healing journey, they really do seem to recover a lot more fully, say, than it would be for you and I to do. Now, at this recording, I've been asymptomatic for over 12 years after taking just shy of 13 years from start to finish
Mm-hmm.
with my healing journey, with getting sick, finally getting that diagnosis 8 years later, and then having about 4.5 years of getting better. So, I'm better. But with our kids, I think that they're much, much more resilient. But I find that, like I just told you a minute ago, that we want to keep it simpler with them and engage where they're willing to do it. On that tail end, as they get better and better, we may need to look at, are they exposed to mold? Do they have mast cell activation? Are there other traumas that are bothering them that have kind of crept up because they were sick? And it's not like the infection caused it, but I mean, we all get, so many of us in this, who go through this experience, get gaslit and kind of accidentally or otherwise betrayed by the medical system. Your kids are feeling this too. So if we wrap up and think about how to do it, one is we may need to go back and grab a few key pieces of rotten fruit and remove them from their whole life after they're kind of recovered from the Lyme itself, if you will. But the
Mm-hmm.
other part is, I would really want to remind all of our parents, um, your kids, even if they're a 13-year-old in the other room giving you the bird and not listening to you, are actually listening to you. You have so much influence over the people around you, your spouse, your children, your friends, and you have to lead by example. So if you're asking your kid to take something 3 times a day and they know you're supposed to take something 3 times a day and you only do it once, well, guess what? The other thing is, model the behaviors you want them to do, including one of the big things is, how do we speak? Right? If somebody's like, damn it, my kid's a limey, I can't stand it, or I'm a limey, because how many adults and kids who go play outside together both have Lyme? You want to model the behavior, and like, while your body's experiencing Lyme disease, so what can I learn from it, and let's move forward. But if you label yourself as a sick person and expect your child to get well and you're not getting well, then that's a different thing. So just look at your language patterns, look at the way you live your life. And if you want your kid to go gluten-free, well, guess what? You got to do it
Jump
too.
on the bandwagon. Yeah,
And
it's really
no
it
cheating
would
when
be
you're not with them.
impossible to have a pantry full of stuff that only one person in the family can't
You all
eat.
have to do it together. Yeah. Lead by example. because you're probably going to improve your own health. But
Mhm.
it's like, and it's so interesting to see the patterns. We're very aware of this at our home. So look at the patterns of behavior and speaking that your child have, because because like my daughter, like I'm like, oh, that's from mom, that's from me. Oh, I get that, and it's like it's really amazing because
They
you can
can't help it.
change
They're
it.
little sponges, right? So I think that's a great reminder for our parents out there that, even though you may not even have Lyme disease, you can go through it with them. You really can. You can say, I've got your back. I got
Yes.
you. We're going to do this together, and let's just explore this new chapter together. And, we're going to do it. So I just want to tell people how they can get in touch with you, but I want to mention that you do virtual consultations and treatments. You're based in Connecticut, but you can
Mhm.
actually treat in about 15 of our states. So anybody who wants to reach out to you, please tell us all how the best ways to contact you or to follow you.
Sure. Our medical practice is originsofhealth.com. And so that's really awesome because myself and we have other doctors in our practice who we can see people, like you said, in many different states. We do offer educational consultations for if someone's in a different state and they need a second opinion or they want to get their doctor on the line. We can all talk and do things like that. And then we have the Thrive with Lyme blueprint is coming out very soon, which is great. Probably by the time people are even listening, it will be out. But that's been the labor of love to basically share with people an action plan for how you can work on these things at home with yourself and your kids. If you can't get in to see any provider that is open to this, or you're working with a provider, but they may not have the expertise of someone who personally went through it for 13 years and then has been treating it for the last 15 exclusively. So it's really a great way to do that.
Amazing. I know it's going to be so helpful for so many of our listeners. And I thank you so much. Please, let's just briefly mention the summit that's coming up for you.
Oh, thank you so very much. This is like so good. Dr. Darren Engels and I are co-hosting this event. And it's May 9th through 16th. And it is every single day. You get free access to all the speakers for that day. We've got, I think, if I can do math in my head, we've got at least 56 speakers, and we're covering the gamut. We're doing kids, we have integrated pediatricians, we're doing gut health, we're doing brain stuff, we're doing PEMF, everything that we've talked about and so much more is covered in there. And it's just a great opportunity. And our goal really is twofold. One is to get great information in front of people who have Lyme and want to recover, have kids with Lyme or friends with Lyme who can recover, and also to let people know how to prevent tick bites. And also, if they have acute Lyme, some of the things that we might do, including herbal approaches. And we even have somebody talking about acute ehrlichiosis that almost killed their dog and how they treated them with an herbal formula that's been studied well in Lyme. So that's a lot of fun. And the other part that's unique about our summit is every night we're doing a live Q&A for about an hour. We're going to do a little bit of Q&A so that if there's something burning from that day, you can get to it. And then we'll give you a full Q&A after, the Wednesday afterwards. But most of those hour-long sessions are going to be personal healing journeys. And we're bringing in a couple of our friends, and Dr. Darren and I are also going to share a lot of the home healing processes that we do that supercharge our healing and now keep us well. And we teach to our patients, and some of the things I even teach in the Thrive with Lyme blueprint, so that everybody can show up on the first day on the 9th, join us all the way through, and they can actually come out a completely different person. So they're going to have new hope and new knowledge and things to do, but they're also going to have a direct experience of self-healing. And that's really like the part that I'm super
Wow.
pumped about.
That's amazing. And it's free. The summit is free.
Totally free.
Totally free. Imagine that. You're not going to find it anywhere else, people. You got to sign up.
And if
And
I
I
can do
love
a
Dr.
shameless
Darren.
plug,
Dr. Darren is one of my personal physicians, and
oh, he's so good.
yeah, he's great.
And you reminded me too. Couple things that are really great about this summit. We brought Global Lyme Alliance on because most people don't know who they are. They've actually been raising a lot of money and funding a lot of the research that's revolutionized the way we've treated Lyme disease in the last 4 or 5 years. And for anyone 25 and under, if you're experiencing any kind of sort of like financial strain, which I don't know who doesn't if you're dealing with Lyme and co-infections. But we also talked to Phyllis Bedford from the Limelight Foundation, because they have provided over $8.3 million in funding, including for many patients in my practice who were hospitalized with psychiatric illness and now are back in their normal life, leading a great life because they didn't have a psychiatric illness. They had psychiatric symptoms triggered by PANS, triggered by Bartonella and Lyme, that now have been successfully treated because they were able to get the care that they deserve. So if anybody needs anything, we have a lot of information there, and I think it's just limelightfoundation.org. But I'm always, whenever I talk, I'm like, darn, I want to make sure people have access to care. And that's why we're doing the free summit, and we're getting you in front of people who do that. And if anybody can donate, like, that's the cool part about Limelight. They literally have all their operating costs covered by a private donor. So every penny that we give them goes directly to a child in need. And so when you're talking about this field and the amount of money some people need to spend, it's like, to get well, it's so great to have someone out there helping us. So that's the other part of the summit, I guess, is just public awareness of all the amazing people who are out there advocating for the scientific research, the financial support for you and your children.
Oh, it's such good work that you're doing. I am honored to have had you on Lyme Time and to see you in person. And I'm sure that we'll continue our work together in some form or fashion in the future. But thank you so much, Dr. Tom, for everything that you've given us, and to all of the hope that you have given our parents today, of those smallest warriors.
Yeah.
So thank
you for having me. And I'm so honored and grateful to have the opportunity to share this, and hopefully we'll, help make the difference in a lot of people's lives.
Absolutely. Thank you. We'll see you soon. Bye.